So we are doing week 5. We have 4 remedies left, and that gives us 20 remedies. So you'll have done the kit. This is the kit that I've put together, and obviously there are heaps of remedies, but these are the 20 ones I find we tend to need the most. So this week we're going to go through Cantharis, Ferr and Phos, Ledum, and Ruta, Grav. So they're the last 4. Can you believe you've done that many?
Can I just ask Tanya before we move on, because I missed the week that you did coffea.
Yep.
That's not in this little book, is it?
Should be. Oh, at the back, you mean the materia medica bit? It is at the very, very back, and there's probably a little line on it. So how that book works, it's got 40 main remedies that it looks at.
Yep.
But at the very back, it's got some extra remedies. So if you have a look.
Yeah, it is there.
And it should be probably in there.
Additional remedies, yeah.
Yeah.
Different homeopaths focus on different things. You know, we all have our favourites and our not so favourites. So I just find that it's a good one to have for, heart racing, insomnia, things like that. That can be an issue for people when they're a bit overworked. Yeah,
because it was good that you put all the stuff in, but I was like, well, it's not in the book. I must ask.
Yeah. But it will be dotted throughout it in different, like under insomnia.
Oh, in the front bits,
Yeah, in the bit where it'll suggest remedies for you, and you'll see coffea will come up in something.
Okay.
But you've got obviously more information to choose from.
Yeah, perfect. Okay, thank you.
You're welcome. All right, so we're going to go through Herring's Law, which I briefly mentioned, I think, a couple of weeks back or a week or so back, which is a direction of cure, basically, looking at to help us work out whether things are going in the right direction or not. It's probably more chronic, but it can still be used in acute. Right. And the remedies, obviously, we're going to go through them and some practice cases. So it's a fairly simple night. Hopefully a reward for sticking it out this far. Now, Constantine Herring is the guy. He was actually a German doctor and born in 1880 and lived to 1800, and lived till 80 in 1880. So he actually started out his career in Germany with a doctor who there was a lot of medicine was splitting because Hahnemann had created this new modality, and the doctors, of course, some of them loved it and some of them didn't understand it, so they criticised it. So it created a divide, as it always has and probably always will. So, he was employed under another doctor to write an article actually showing that homeopathy doesn't work, basically. So he actually took it on quite seriously and went, right, I'm really going to study this and see. But through studying it and through doing all of this, he discovered that actually it works. So he actually Hahnemann responded to a lot of the criticisms of the doctors in that day, and he said, repeat the experiments, repeat them carefully, accurately, and you will find the doctrine of law of similars confirmed at every step, and it does what no medical doctrine, no system of physics, no so-called therapeutics ever did or could do. It insists upon being judged by the result. So he was getting the result. So he asked people to look at the results, not what it was, so to speak. So Herring decided to accept that challenge, and he did a lot of experiments for himself on it, and he realised that actually this stuff works and that he's right. So, and then apparently he also had an incident where he injured and infected his finger, when they were doing autopsies, and it was so serious that doctors actually encouraged him to amputate his finger. But someone else who was a friend of his who was into homeopathy encouraged him to take some arsenic amalgam. And it basically cured his hand and saved it, which he was very grateful for, because of course it meant he wouldn't be able to work. So he then dedicated his life basically to this. And he said he saw the light of the new healing art, and basically he dedicated the rest of his life. Now, when was that? That was early on. So then in 1829, he went to the USA to help them with the Asian cholera epidemic. And then afterwards, he decided to stay. And so that's when he really began to publish a lot of these works around guiding symptoms of cure and what to look for to help other physicians. So he's plays a very important role in homeopathy. So that's why I'm sharing this with you. Now, his law, he says basically, in right healing, disease leaves the body in this way, in the reverse order of appearance of symptoms. So, if it starts in your foot and ends up on your head, it will clear from the head first before it clears from your feet. Because that was the last place, basically, that it appeared.
That's sort of the first place that's treated.
Will be the last place, yeah. So first place is treated. The first place for it to arrive is the last place for it to clear.
Worth remembering.
Yeah. And then from the inside to outside. So leaves the body from the in. So for example, if we talk about asthma, will then often come into eczema before it then leaves the body. Because we also know that eczema, if it's suppressed, can create asthma. So it gets driven inwards. So it does the reverse of that. So the body, it will bring out what's inside in order, the safest place is on the skin of the body, really, than on its internal organs, its important organs. And so it also goes from the greater organs, meaning the important organs, out to the lesser organs. So if we were looking at it in terms of kinesiology or Chinese medicine, it will often go from yin to yang organs. So from lungs to large intestinal, and clear out that way. From the head space first. What he means there is that if there's a lot of issues that are happening emotionally, mentally, the mental stuff will calm first before then maybe the physical stuff will clear. And that's often how we're told, because if the head stuff really is interfering with the physical, then it needs to be, because it's always taken into consideration in choosing remedies. What we tend to find is people say, I just feel calmer. I haven't had any change of symptoms yet, but I actually feel calmer. We know that then the change of symptoms come along with that. They will be on their way. And from top to bottom, so meaning generally it will leave, it's going in the right direction if the rash or the illness or whatever is sort of coming down the body and out the feet. If the rash is continuing to come from the feet and up the body, then we go, it's going in the wrong direction. We go, okay, that's not so great. So it doesn't.
Why is that described as from the head space first rather than from the head?
It's old. It's just old language.
Is it okay? Right.
Oh, head space. Head space probably means mental.
Okay. I see.
Old,
right.
Old version of mental.
Right. Okay.
Yeah. Emotional, mental.
Okay. Yeah.
Yep.
Thank you.
Yeah. And then they suggest that you use the acronym RIGHT to remember these principles. Right. Reverse. That's why I've highlighted them inside, greater, head. Now, this is a guidance. It's not a definite Doesn't always go this way, but you will find bits of it happening. So you will see that. Well, we all know that if you've got a rash happening and the rash is spreading more and more and more and more, you know that that's going in the right direction. You want it to reduce. You don't want to have more spots appearing. You want to have no new spots appearing, and you want to have some spots clearing. You can do that in acute. So it's just it's a way to make you not be, to give you more confidence, to not feel that it has to just be completely gone, that there might be a process to this. Any more questions around that? Because that's all Herring's law is. It's fairly simple, but it's just a nice little thing to have in the back of your mind. You don't have to do it letter to letter or any of that. Okay, I just thought I would introduce you to that because I did mention it. It can be a nice little way to show. So we're going to move on to remedies. So Ledum palustra. It's for animal bites, stings, puncture wounds, anything to do with puncture. Black eyes, joint pains. You can use it for tetanus or anti-tetanus. It likes cold application, and it can stop the spread of infection or venom from being bitten. So it is another one like apis. We've spoken about apis with stings and things like that. It is another one that is very useful. It's very useful for animal bites too, to stop infection. Animal bites, stings, mosquitoes, bees, puncture wounds, old black bruises. So if arnica hasn't shifted the bruise and it's still staying there, then you would switch across to Ledum to try and clean out that bruise. Same with black eyes. It's very much a black eye remedy. Rheumatic pains, it does have aches and pains in it as well, and particularly for ankles and smaller joints. It's got gouty pains and heel spurs. It does seem to be around the feet. And as you can see, it looks a little bit like rosemary there, which it is known as wild rosemary or marsh Labrador tea. So it's sort of one of that family. So again, it's very much a puncture wound, anything to do with being pierced, punctured, stings, bite, nails, sharp points, any type of penetration, even knife, all of that. But the area can swell and it can feel cold to touch, and it can have a mottled or bluish colour. So again, we were saying with arnica, any discoloration of bruises which are dark and last a long time after injury, I would move across to Ledum to clean it up, to get rid of that. Insect bites again, which are often cold. So in apis, I don't know if you remember, in apis, it was hot swelling. This is cold. There is no heat in it. So even though the patient's cold, they don't like the heat. The hotbed is too hot. So, when we go down our worst and betters, they're actually better for cold application, even though they might feel cold. And they even like to put their feet in cold water, which is interesting. So twitching, sometimes they will have twitching muscles around the wound. That can be a sign of the infection progressing, which is not a good thing, but that's all part of the picture. Rheumatic gouty sprains, pains which travel up the limb. So these ones can feel hot but still look pale. So there's still a paleness to it. So there's no redness like in apis. It's got a lot of that redness as well as heat. This won't show like that. So it can be a bit confusing in that sense, but it will often show itself actually a little bit of mottled or a funny colour. Soles of feet painful and tender, and it's worse heat, movement, or any pressure on it. It seems to be worse at night. So better for ice and resting it. They don't like company. Sometimes you'll get those symptoms, other times you won't. The mental symptoms can be harder to find in Ledum than some of the others, and it often stops the spread of infection or venom. Yeah, I've used it with the horses a lot, just standing on things or getting sticks in them, even with kids, splinters, things like that look a bit not great, like they could cause infection or problems. I get straight on to the Ledum. Any sign of possible, an infection from an injury, especially if it's pierced the skin, that's what I'd use it for. So tick bites, stings, anything, cold, puffy, mottled, nails in the soles of the feet, people step on old nails from on wood or things like that, cuts. And any septic states or things you think might be going to go septic, I would absolutely put Ledum in there as well. Obviously, we want to try and get it before it goes to the septic state, because when it gets into septic state, it's a lot harder to clear, and you really probably need help with that. I wouldn't necessarily try and do that by yourself. So really, in the end, we're really just trying to prevent the septic states. Again, the joints, joint pain, warmth aggravates. And so usually a lot of joint pains, they like warmth. It's usually the other way around. So for people to feel like they want coolness on their joints is a little bit different. Stiffness, obviously, again, worse for warmth. Rheumatism starts in the small joints, often in the feet, big toe or the gouty stuff. And generally, ankles as well. And this is the black eye. This is the black eye remedy. if you're thinking of a remedy, this is what I go to. Now, obviously, you would do arnica first. I would generally, even for a black eye, because usually there is some swelling and bruising initially, and then I'd probably give a few doses of the arnica, and then I'd probably move straight across to the Ledum. We do also use this overseas often, and so we can use it here for tetanus and mosquito prevention. So it is very good for mosquito. I did even notice in a blend that someone was using that they used Ledum as one of their anti-mosquito bite preventions. So I thought that was very interesting.
I will give that a go because the mosquitoes love me.
Yeah. It's a nice little, I would take it, afterwards when you get bitten, So you can take it.
The problem being that at the moment with the, what's it called? The Asian encephalitis or whatever it is, that if you get bitten by a mosquito, if you're in the top of Victoria, so up near the border, or in South Australia, there's a big problem. And because I get bitten really easily, they love me. I'm just going, mosquito prevention, where next year we're going into outback South Australia, which has a big problem with the Asian encephalitis. And I'm sick of putting on all those, mosquito repellents, which don't seem to work. I think they attract mosquitoes sometimes.
Oh, right.
But I'd give this a go over this summer, and if that worked, then that's what I'd use as a preventative.
Yeah. Ledum and Staphylococcus aureus can be another one as well. So, but start with Ledum, and absolutely you do that. But there also there are essential oils, obviously, you can use too. I don't know if you've done any. I have
tried a couple, but I probably need to, try a few more.
Yeah.
I find you can buy those bracelets.
Don't work.
The rubber bands. I wear 2 of those and they're great for me.
Yeah, I don't know. They just seem to really love me.
No.
I've tried, I've bought just about everything that's ever been on the market and I still get bitten.
So yeah, absolutely. You could take it beforehand as well as after. Like you wouldn't just do it just beforehand.
Yeah, I'd probably do it for like the week before we left and then continue while we're away and hopefully not get bitten.
Yep. There is a couple of other remedies too, but Ledum and Staph are probably the top two I would be looking at.
Right.
Nat Mur sometimes as well. But all right. So clear. Is that sort of? It's a fairly simple remedy. It's not a lot of variety in terms of what things that it gets used for. It's quite specific. This puncture wounds, joints, and they're the main sort of things that you use it for. Obviously, mosquito is just a puncture wound. All right. So Ruta Grav. This is often used for eye strain, joint and bone problems, ligament sprains and strains, which is also teeth or dental work, overexertion and lameness. So it's more centered around the ligaments and the joints, which is the same with the eye strain as well. The eye strain is often more ligamenty. So sprained wrists and small joints, nodules as well, ganglions, bursitis, tendinitis, tennis elbow, sciatica, back pain if you're bruised and weary, and dental extraction. Again, there's a lot of ligaments around connecting all the muscles into the spine and things like that. So it's called common rue, bitterwort herb, or grace, the native shrub to southern Europe. So rheumatic and connective tissue problems, chronic or overuse strain, injury of joints or tendons. Small tendons of the eye may also be affected, which is why you get eye overuse or eye soreness. The person complains of soreness and stiffness, sometimes of the whole body. Even raising from the chair can be difficult. Pain and stiffness is worsened by cold, damp weather and lying on that part. Warmth and gentle movement eases them, and sometimes anxiety and panic attacks. This particular remedy, I pretty much use it routinely after surgery to do with any sort of bone, knee, joint. They don't tend to do surgery on the muscles so much, but because it's always
muscles can be moved around during some surgeries, so that that impacts them.
Yes, absolutely, because the ligaments will be affected when they're working on the bones, because of course that connects the muscle to the bone. So always be looking at that. Soreness, general symptoms: soreness of parts laying on, aching pains in eyes. This can be from poor light or doing too much fine work, that needle work where they do that black thread sewing on black cloth. Like, it's really hard to see, and if you do that for a long time, your eyes can become very fatigued and sore. So it's a good remedy to just help them come back. It can have blurry vision as well. I had a client come to me many years ago, and he was working on I think it was a printing press or something, but he was getting really sore eyes from it because he was constantly looking at it. Yeah, the Ruta Grav was what he needed for that. So sprains and strains, feelings of bruising in bones and weakness, tendons feeling strained and sore. It's main focus. Lameness after injury or overexertion, again, it'll be to do with the tendons and the ligaments. Damage to tendons, cartilage, and perosteum. So it's that coatings and that area again, not so much the bone themselves. Worse sitting or lying, overexertion, touch, cold, wet weather. Better for warmth and motion, or lying on the back is okay. But that's because unless your back's sore, that probably won't work then. Wherever it's sore, it doesn't want to lie. Cold water, juicy things, and it's useful after arnica. It's generally the remedy I will often use afterwards if it's an injury, not just a muscle bruise or a muscle. Yeah, it's more if a lot more than just the muscle has been affected.
You suggested this to me, Tanya, on that day that we did the that first session at the introductory one at the community house.
Yep.
And I said I'd had a fall and I'd torn all the muscles off my ribs.
Oh, yeah.
and you said, take this. I went straight home and started taking it. And you said you might have to take it for 3 or 4 weeks. 2 weeks and I was back to normal.
Oh,
I was
wow.
amazed. The pain went with my first dose.
Wow. Yeah, cool. Thank
And
you.
within a week, I could lie on that side of my body for a brief time. But by the time 2 weeks was up, pretty much, I was back to normal.
Oh, yay. Well, thank you.
So it works brilliantly.
It's funny, because like I say, I give it routinely for a lot of things, and you forget, and people don't realize they heal so much quicker. Sometimes it's taken for granted. Like you think, oh, I would have healed anyway, but you don't realize until like you've got a situation where it's not healing.
Yeah, it wasn't. Nothing was working.
Yeah, and then you come in with it to heal it, and then you actually see the difference.
Well, I was living on painkillers, and I knew that was no good for me.
Yeah.
But I hadn't thought of anything else. I'd taken arnica at the time, but it was the pain that I couldn't manage really well, and I knew it was going to take time to heal. But this just it was way faster than I ever imagined it would have.
Yeah.
I expected it to take at least a month.
Yeah. Yeah. We do say that as well. We generally say what the normal healing level as to what it would normally take for someone to heal, it will halve that amount of time. So yeah, that would be about right, 2 weeks.
Yeah, absolutely.
That is a rule
Brilliant.
of thumb.
I will never forget. I'll always know when to use this one.
It's funny, isn't it? When you have those experiences, you never forget them.
Yeah.
Be one under your cap.
Yep.
So, all right. So eye problems again, eye strain, headaches again, also from prolonged reading, fine print or doing needlework, and or artificial light as well can cause it. It can have stiffness, burning and redness in the eyes after overuse. We all know what that's like, so it might be worth giving it a go. Weakness and stiffness in the joints and the bones, particularly after surgery, is a big one. But even in general, if they are just, sore, tired, overused, it can be a really good one. It's also quite good for nodules and nodules on tendons. I think we mentioned that earlier on, bursitis, ganglions, things like that people get. Yeah, it can be very good for helping clear those up. And fractures, surgery to any bony areas. Tendons, tennis elbow, small joints. I think we've covered most of them. Back pain, a bit of sciatica, which is helpful when you lie down. And tooth extraction, I will often use it in tooth extraction too, particularly. Not so much fillings or any sort of major dental work, I would use it. They talk about it preventing dry socket, which just means that it heals nicely. Yep, on to the next one. Any questions with that one? That was pretty clear. And Chris's story was a good example for how to use it, which is always nice to have stories to help us remember. So Ferr and Phos, this is we'll often give this at the start when we're really not sure and we don't have a clear picture, but we know something's not right. They have a generally off colour. There's no distinct clear symptoms. It can come on obviously after mechanical injuries, like someone has banged themselves or injured themselves. So it also is very much to do with nosebleeds, anything to do with blood. Ferr is an oxygenator of the blood. So nosebleeds, blood loss, anemia. Ferr is iron. So you would think of iron when you think of anemia, which is low iron levels. It's good for colds, congestion. It has got weakness and paleness in it, as you can imagine. Low iron has paleness in it. So you can use it for headaches, sore throats, tonsils, fevers, colds, ear pains, nosebleeds, coughs. The coughs often have a little blood streak through them. Tells you again to do with the iron in the blood. Early stages of bronchitis or pneumonia, and it can look at heartburn or indigestion. But it's iron phosphate or ferrous phosphate. It's also a tissue salt remedy. So you might.
I was going to ask that. So it is the same.
Yep, it is exactly the same. It's the same, but used differently and different potency. So remember from when we were talking about potencies. So just to refresh, I'm not sure if Kat and Lynn, but the potencies, we have two different scales. We have a 1 in 100 scale, which is the centesimal scale, and we have a 1 in 10 scale, which is the decimal or X scale. So it's represented by an X. You know, X means 10. So the tissue salts are all in that lower, which means there's still physical traces or chemical traces of the remedy or the substance in the homeopathic remedy. Whereas in the C scale, I think you get to about 12C. After that, there's nothing that they can chemically detect. It's all vibrational. So a 30C of Ferr and Phos is very different to a tissue salt, 12X, 30X basically, but they go up to 12X really, maximum of Ferr and Phos. So we use tissue salts. We will use also tissue salts for anemia or things needing to oxygenate the blood a bit more. So, but you'll use it more like a supplement. Tissue salts are a bit more like a supplement.
I was going to say we used them years and years ago. My mum was right into tissue salts, and but you had to take them like regularly to have any impact, like 2 or 3 times a day. Yeah,
because they're very small, as in how much is in there, and they're basically like taking a supplement.
Yeah.
They balance out. So tissue salt, there's 12 core tissue salts, and the tissue salts are all basically all the minerals or the salts of the body that the core salts the body uses to build as building blocks. So when we're cremated, or people are cremated, you know, all those bone and salt, all of that, what's left in there is 12 salts, 12 minerals. So they're considered the core building blocks of the body, which is why we use them like a supplement, and they can be very useful. Some people only use those in acutes, but you do have to use them a lot.
Yeah. And back then they were pretty expensive.
Oh, were they?
Were they? Gee, they've always been quite inexpensive. In my lifetime.
Because you had to take so many.
Oh, okay.
Oh, yeah.
You're replenishing regularly.
Yeah, you can take them up to 6 times a day. That's true.
Yeah. But they worked. They did work.
Yeah. Well, this would have been quicker.
Yeah, absolutely.
I think the Ferr and Phos tissue salt, they advertise it as first stage of illness, and I found it invaluable for the whole family. Said anytime a sore throat niggles or a sniffle or whatever, you get onto it, and I've turned that around so many times where the next morning there's just nothing. So I particularly like Ferr and Phos.
Yep. Well, this is another way you can use it in the homeopathic form as
Yeah,
well.
that's great. Mm.
Yeah. So it's used in a very similar way, and it
Mm.
is for exactly that, to help oxygenate the blood
Mm.
and build the stamina. So it's made of iron and phosphorus, and they independently, phosphorus supplies sustenance to the bone and muscle health, while the iron aids the exchange of oxygen in the blood.
Mm.
So Ferr and Phos is made from mixing iron sulfate, phosphate, and sodium acetate, and the powder is then triturated, meaning it's ground for a certain time with mortar and pestle, combined with a certain proportion of lactose, and then made into a tincture. They try and just make it into something that can be dissolved and then made into a homeopathic. So, but this remedy in particular, like you said, no clear symptoms. It's vague, it's general. There's no definitive things like fevers, pain. They might present, but they don't have like the headache is just a headache. There's no pulsating in it like belladonna, or worse for movement like baronia. It's just often we'll use it at the start. Anything looks like it's brewing, or even if it has brewed, but there's nothing really distinctive around it. So symptoms are so vague that no other remedy suits. You just give Ferr and Phos and hope for the best. And usually it's pretty good. And like you say, Lynn, you can stop things in their tracks. There is another remedy called PCIP, which is a Blackmore's celloid, and it is PC means IP, means iron phosphate, and PC was potassium chloride. And it was a little mix that when I very first started to even learn about homeopathy, before I started really learning about it, was my first introduction to sort of tissues or celloid mineral way of treating.
Mm.
And that was that. They'd give 2 tablets of that every 2 hours to prevent a cold.
Yeah. Good.
Same sort of stuff. So it's all based around, though, Ferr and Phos, which I think is interesting.
Mm.
So this is for any inflammation, redness, pain, or fever, cutting pains, it does have in it. But again, if it doesn't, still use it. That generally off colour. It actually is good for ailments for loss of blood and loss of sweat or fluids like that. Yeah. Nervous, they can be nervous and sensitive and anemic. Better for gentle motion or exercise and warmth, and worse in the cold air and exertion, as you can imagine. They're usually quite tired. So more exertion just makes them feel worse. Again, headaches with the fever, they can have a fever, and the face often alternates between pale and red. There's usually a paleness element to it. There is light sensitivity with the fever as well, but not always. Earaches and inflammation with no discharge, and they can get deafness from cold, especially in the kids. But there's inflammation, but there's no discharge. There's no real definitive things with it. There's no real redness in the ear. There's no, they just know they're sore. Bright blood. The blood can be bright, really, is what that's saying in the nosebleeds. It's not necessarily a dark colour. They're a bright colour. Throat tonsils can be raw. Painful sensation can be in the soft palate or the posterior nares at the back of the nose, particularly on inspiration. Redness, swelling of the tonsils. So you can still use it even as symptoms develop, but you can definitely still consider it. There is usually a thirst with this one, but they also can have nausea or vomiting after eating. So whilst they might be hungry, it doesn't go down well. Heartburn or indigestion after eating meat. You often wonder whether that's the iron as well affecting things. Something's not, gelling. Chest problems, it can be at the early stages of bronchitis and first stage of pneumonia. Again, you're not necessarily going to know that. You just treat it and hope that it doesn't turn into anything like that. Sometimes we don't know what we've prevented, but we know we've done it. So cough with the bright blood streaked expectoration. So yeah, sometimes we will have streaks of blood in there, which tells you that the Ferr and Phos condition. Again, the fever can be high, but there's no distinctive symptoms with it. So see how you go. Okay, Ferr and Phos, is that it? For Ferr and Phos, oh my gosh. This is the last one. Cantharis, what have we done? This is the last remedy. So we've done Ledum, we've done Ruta Grav, yeah,
Ferr and
and we've
Phos.
done Ferr and Phos. So this is the fourth and the last remedy. Oh my goodness, my phone's going. Okay. So Cantharis. This one is for burns. Think of this one for burns and UTIs. It's the main things it covers. Burns, bladder infections, injuries that burn. They can be violent, acute, scalding, raw, and burning. They're all the feelings that it feels like. And this comes from an insect. Cystitis is a big thing with it. Sore throats as well. Cold sores and burns and scalds, sunburn, burning, and blistering. When Tamara was 10 months old, we went to on holidays, and you know, when you're out of your normal routine, I put her in a high chair and was heating up some food of hers in a bowl of boiling hot water, and it was all safe on the bench away from her. But then I moved her high chair so she could see what Aidan was doing, because she couldn't see what he was doing. So I moved him. I didn't realize I moved her closer to the bowl of hot water with her food in it. She decided she'd go and try and grab the food, and in doing that, poured the whole hot water down her arm and had basically second-degree burns. It's still very hot. And the jumpsuit that she was wearing stuck to her arm. We took her down to the hospital, obviously, and they plunged her arm in ice cold water, and the poor girl was screaming. She was not happy. It was not a pleasant experience. But Cantharis was the remedy that I gave afterward for the burns to help it heal, and it did a brilliant job. It went from like a burn that sat this big on her to like a little round spot, which it's funny, the memory of the body, because every time she had a bath, it would show itself.
Just to remind you.
Just to remind me. But eventually it slowly cleared. But Cantharis, and also I put aloe vera gel externally on it as well. So they were the remedies that we used. And I've used this a lot for UTIs. It's a big remedy for UTIs. So Cantharis prepared from this iridescent green beetle. It's actually toxic, so you wouldn't use it except in homeopathic form. It's a remedy for inflammation, mucus, and particularly that of the urinary tract, but also it has gastrointestinal issues as well. And the symptoms come on quickly. So again, like belladonna, aconite, these things emerge rapidly. There's some remedies that are just quick onset. Inflammations produce intense cutting and burning pains, and they can blister or ulcerate. Bright lights or reflective surfaces can irritate them, and coffee can worsen the symptoms. And that's often, you know, coffee stimulates the adrenals and everything, so it gets all that heat and everything moving, and they don't need more of that. Plates develop rapidly, and the painful urination with burning, scalding, cutting pains, and great urgency. So this one, remember I've told you a story about Apis, using that for UTIs. Cantharis is the other one to look at. And I used Cantharis, I've used it with people in UTIs, and I've also used it in a dog who had constant UTIs as well, and it worked really well. So it's got these scalding, cutting pains with great urgency and frequency, with spasms in the bladder, you know, that feeling like it's cramping almost. But they can't pass much, just drop by drop. Although that is a general UTI symptom, it's not always. They have a great thirst, but they don't want to drink water because, of course, it makes them want to wee more, which then painful and all of that. So they often don't like water even though they're thirsty. Sunburns, brilliant for, and burns in general, often they will burn and then blister. So any sunburn that blisters, definitely take Cantharis. You've usually got this burning, stinging, and cold sores as well. If that's got that burning, stinging, they can be quite large. Pain, I'd be looking at Cantharis. Better for warmth application, rest, rubbing, lying down. Worse, looking at bright objects, drinking water or coffee. Even the sound of water and urination, obviously, they don't feel better for, especially if they've got a UTI. It doesn't help relieve things. So, what does this say about burning, stinging, cold sores? We did speak about one other remedy, I think, for cold sores. I can't remember what that was. It'll come back to me. All
And
right.
you have this in nursing homes.
Oh, for sure.
Mm.
Yeah. Yeah, they get a lot of UTIs in this home. This one, Cantharis, Apis, and the third one I often use is Staphylococcus aureus. But yeah, there's just a definitely. Yeah, they get it all the time, don't they?
They live on antibiotics, half of them.
Yes.
Terrible.
Mm.
Yeah, which then affects the brain too. So, UTIs, burning, cutting, stinging. That's just basically anything to do with burns. So Cantharis, if you know it, you know of it as a burn remedy. You also know as the UTI is a burning pain. So it's good to link those two together.
Was Natmer the other one you were thinking of for cold sores?
Yes, it is. It is the other one. Let me just go back. Something triggered me and I can't remember, but I thought I'll go back to that. No, it'll come back to me. It may not be important. All right. So, yes, it was Natmer, but I can't remember why. Frequent urging, yeah, severe spasm and pain, retention of urine, and can't pass much, just drop by drop. Cold sores that burn, sting, itch, can form large blisters and can bleed. Digestive again, yeah. Yeah, cold sores. And burning thirst, aversion to drinking again, even though burning and a blood-stained diarrhea, it can have that in it. But it's usually accompanied by some sort of bladder inflammation as well. Just seems to be the way. Skin again, burns with intense pain, burning and itching blisters, better for warmth. Oh, that's right. I think I was talking about the shower, and that's right. Remember how when we talk about burns, I think it might have been, was it Apis? Oh, I can't remember. We were talking about like treats like, actually, and the fact that you know, of all things for a burn, you'd expect to want cold, but actually warmth makes it feel better. And that's another sort of version of like treats like sunburn. We're talking about sunburn, and the fact that actually a hot shower can relieve sunburn.
It's what my mother always did every time we got sunburnt. Go and have a hot shower.
Yeah. And it's a great example for like treats like.
And she didn't know anything about homeopathy.
No. You get examples of it in life. I mean, it's a natural law. So, you know, sometimes the truth is the truth.
But most people went, why would you do that? And my mum just said, well, that's what I was taught.
Yeah.
And so that's what we'll do. And it always worked. It took the sting out.
Yes. Yep.
Didn't help with the healing, but it took the sting out.
It eased it, even if it didn't help it heal quicker. It'd be nice if it had healed quicker too.
Yeah.
All righty. So you ready for some cases? And you'll be pleased that, well, at the end of all of this, I put the answers for all the 5 weeks so that if ever you want to go back.
In case we forget how to do it.
You can cheat. I've given you a cheat sheet. So Annette been working on a computer all day until late in the evenings for a few days now, and that night her eyes began to feel sore, they began to burn, a headache was brewing and her vision was blurry. She was exhausted, tired and wanted to go to bed but felt restless and uneasy and she couldn't work out why. What would you give her?
Ruta, is it Ruta Grav?
Yep. Everybody agree?
Yeah.
What made you point to that, Lynn?
Well, the eye strain.
Yep.
I took really a couple of notes down, so I can not too sure what else. What was the other thing there? Burn. She was exhausted and tired, and wanted to go to bed, but felt restless and uneasy. So was that the one worse lying down?
Yeah.
Worse.
Yeah.
Yes, worse by lying down. Yeah, I don't know what else.
Yeah, they're the main
Vision
ones,
was
really.
blurry.
Yeah.
Yeah, the eye stuff. Yeah.
Yeah, it was all based around the eye, wasn't it? And also the fact that she'd been doing it for a few days in a row as well. Yeah.
Yeah.
You know, like it was strain. Definitely
intense eye work. Yeah. Eye
Yeah.
strain.
Okay, excellent. So Shane had a job interview that morning, and it's been a while since he'd had an interview and was nervous and sensitive about it. That afternoon he was just feeling off. Couldn't work out why, but he wasn't feeling himself. His head sort of hurt. There was a vague feeling of a headache coming on. He was a little lethargic, but wasn't sure why. It felt like a cold coming on, but he couldn't tell. He had been weeing a lot more than usual.
Is that Ferr and Phos? Like that vague sort of those vague symptoms?
Yep.
Cantharis.
Yep. Okay.
Oh, you've got what? Cantharis? Because of the weeing, I've thrown you, haven't I? The weeing.
Yeah. But the Phos was for all that vague, not quite sure.
Yes. And they can be a little bit sensitive as well, and anxious, nervous and sensitive too. Just as they're just a bit off colour. So yes, I'd probably go to more. There's probably not enough symptoms, I would think, to say Cantharis. There's no real burning. There's no real any of that.
Yeah, the weeing is just anxiety.
Yes. Yes.
An anxious bladder.
Yes, that's the one. So yeah, and so it's good because we will get confused sometimes as to symptoms aren't always going to be lovely and put out like I've put them out for you. So John jumped out of the pool, went running inside, and he didn't notice the rose cuttings on the path. He stood on them and got a thorn in his foot. Later that night, his foot swelled and ached. He just wanted to rest and put it in cold water. It felt hot but looked pale. What would you give him?
Ledum.
Ledum.
Yeah.
For the puncture wound and for the cold water fever.
Yeah.
Yeah.
The swelling. Yeah.
And the pale. Yeah. Swelling. All of that.
And often it's often to do with injuries to the feet.
Yes.
As well.
Yep. Injuries anywhere, but yeah, it was all in the feet, which was interesting. So yeah, lower limbs can be, but it doesn't have to be. We don't. Yeah. So Jean required knee surgery and wanted to make sure she had something to help her heal quicker afterwards. She asked her friend, for advice. She thought of this remedy, knowing it helps tendons, ligaments, and injuries close to the bone.
Ruta.
You're never going to forget that one.
Mm-hmm.
Okay. So Janine has been visiting friends, but later that day she began to get slight cramps in her abdominal bladder area. So she went to the toilet hoping it was just a full bladder, but when she went, her wee stung and burned. She also had trouble passing as much as she felt like she needed to.
Cantharis.
That one's Cantharis.
Yeah, that one's definitely Cantharis. You can see what are the bits that stick out.
Well, the burning symptom and the bladder, she sounds like she's got a urinary tract infection or
coming
something.
on. Yep.
Yeah.
Yep.
What else? Don't know what else on there. What she began to
Emma.
get slight cramps. So we have, was that one for cramps as well?
It does have a little bit of cramping too in that
Yeah.
area, in the bladder area. Yeah.
That area, yeah.
Yep. So just as a side story, there's a lady in America who is doing wonderful things for homeopathy. She's on the board of, she's just a user. She's not a practitioner, but she's written some great stuff on helping families use it in their homes in America and things like that. And her story was her parents emigrated from Brazil to America, and she didn't. She had chronic cystitis where, and no one could fix her. The doctors were recommending lots of different medications, surgery, you name it. They were mentioning it, and she said she asked them about the side effects, and really her prognosis was not very good in terms of the side effects she was going to produce. So she did acupuncture, she did lots of other things, and then she tried homeopathy, and they gave her Cantharis, and it was fixed within a couple of weeks. She'd never had. She was shocked.
Yeah.
So she became a champion. But she said these little white pills that they gave her. She vaguely remembered her mother giving them to her, and so she went home and said to her mother, "Didn't you give me haven't I had these before?" And she said, "Oh yes, the doctors. We used to see a doctor in Brazil that gave us these remedies." But of course, we came to America, and that was all what the poor people did, and so we wanted to use all their modern medicines and all their stuff like that. So she chucked her kid out, and they were just going to say that she never used it with the kids again until this happened. So she's been a bit of a champion for homeopathy and keeping it alive, because they're trying to kill it in America. So very aggressive. They're very aggressive with it, actually. So yeah. So I thought, interesting, hey, with good old Cantharis as a remedy for chronic UTI. So anyway, so all right. So Louise was out gardening when she knocked herself on the nose with the pruning saw as the branch cut off and flung back into her face. We've all been there. She didn't think much of it until her nose started to bleed and she began to feel weak and not herself. She realised too that she'd been out gardening longer than she thought and had not worn her hat. She really could do with a drink of water, preferably with lemon, but it didn't alleviate it as much as she'd like. There's a lot of information in there.
You've thrown everything in there, haven't you? So is it Ledum for puncture wounds, or Ferr and Phos for nosebleeds, or or the heat overheating, the one for sunburn and everything? Yeah. Got it. So what's the differentiating point?
So the differentiating is it's the nose, the basically the nose starting to bleed, feeling weak and not herself. So loss of blood,
heat from the sun,
and also
so Ferr and Phos.
Yeah, and it can also, being out in the sun can aggravate them as
well. It says heat of the sun or mechanical injuries.
Yeah.
Right.
And also the desire for lemon.
Yes. So I don't think I've
it's in the book.
It's in the book.
Yeah, it says desires lemon.
Just give me 2 seconds. I've just had an emergency message. Put that thought on hold. Okay, apologies. See if that sorts itself out. So we said Ferr and Phos, didn't we? Yep. Yeah, mechanical injury, the bleeding, not feeling, loss of blood, not feeling very strong, and also yes, the water. But I don't know, Lynn, have you got the Rainbow book?
No.
Okay. There's a little bit more of that in there. So
Yeah,
that would have confused
yeah.
you a bit. Of the lemon I haven't put in this.
That's
in this
okay. Yeah,
slide.
yeah. No,
All right.
just yeah, yeah.
Yep. So they're the main things with that one.
Mm.
So Peter was out late drinking with his mates when a fight started. He tried to help break it up, but got punched in the face, then fell over in the process, spraining his ankle, and he went home with a black eye and a sore leg. What would you give him?
Ledum.
Ledum, is it?
I'd probably tell him to stop fighting.
Or stop breaking them up.
Yeah, stay out of it. Let someone else do it.
Exactly.
Yeah, lead them.
You reckon lead them? You all think lead them?
Yeah.
Yeah, well, black eyes and sprains, isn't it?
Yeah.
And it's was it and leg and remember what else? Was I trying
Ankles
to-
and stuff. Yeah.
Yeah. Hmm.
Yeah, it
Punched in the
ticks enough boxes.
face.
Okay, Denise has been holidaying at the beach. She loved the sun, the fresh air, and made the most of it. However, she stayed out a bit longer than she's used to, and that night her skin felt burnt, painful, and even showed signs of tiny blisters forming. It was surprisingly quick to come up, and she was concerned. What would you give her?
Cantharis.
Yep.
Mm.
Because
Burn.
Burns, yeah.
Blisters.
restless, yep. Burns.
I'm having real trouble with it. And blisters, blistering.
And the blisters, yeah. Sorry,
Yeah,
yeah.
blistering, yeah.
Um,
And that came up.
what did you say, Kat? Sorry.
That's what I said. I said the blisters,
Blisters, yeah.
sunburn.
Yeah,
blisters,
and
what I
quick
heard.
quick onset
and
of
quick to
symptoms.
come up.
Yeah.
Yeah, good. All right, so sorry, all right, sorted. Yeah, so that's the the 8 of them. And so on this last page here, I have just listed week 1, week 2. So week 5, did we say that? Ruta, Grav, Cantharis. The
Yeah.
last one was Cantharis.
Yes.
We did say that, didn't we? We did Ledum as well.
Yep.
Okay, that's great.